Good afternoon, everyone. Delighted to be here for another podcast within CDMO Live. I'm really delighted now to be joined by Carlos Ucero from Capital Farma. Carlos, welcome. Great to have you here as part of the podcast. Looking forward to a conversation today. Give us a bit of an introduction, who you are, why you're here, what you're hoping to get out of the event.
Yeah, I'm here representing our company, which is Capital Farma. We are a small and young company, but pushing hard in those days. I'm managing all the CMO scouting and tech transfer planning and controlling. So it's our first time in the platform. We're very pleased to come here because it's been very useful. My objective here is spread my network in this area because I have been working in Capital not so far because we have only 3 years. We are a baby company.
Yeah. Yeah.
Before a small company, it's baby company.
Yeah.
No, but we are growing so fast. And my duty here was to spread our knowledge about how the industry is going, how the players are moving, and meet new partners and scouting new options to increase our business, which is the aim of the event. So
well, fantastic, and thank you so much for being here. We're delighted you're here. It's great to hear your story over 3 years. Obviously, a lot's happened in that time. What's been the highlight of CDMO Live so far for you?
Yeah, for me, I think it's to realize that there is a real focus pointing on the industry and knowing and feeling that there is change around here. Because when you talk people to people and you tell the story, because we are a 3-year company, but I have more than 16 years experience in health industry, so our team is tired of talking and watching how things are moving from one side to other, And now you realize that there is a global feeling that things are going to change, and the effort is going to make that it happen. So for me, the good thing is talking with everyone, you feel that something is going to change, that there is an aim, a global aim, and people is going into the same direction. So for me, I feel more strongly.
If you had to sum up the event experience so far in a couple of words, what would you say? I'm sure you go to lots of events. How would you summarize?
It will be very, very simple, but interesting is the thing. Sometimes, even in this kind of events, when you have a meeting and after meeting after meeting after meeting, sometimes when you have 3 hours speaking with people, you get so tired, but I feel very comfortable and I need to talk a little bit more,
Oh, that's great to hear. That's great. We're delighted to hear that, of course.
So
you talked about focus. For us, we really believe that there is absolutely a need for an event like this that absolutely covers the outsourcing, the external manufacturing, the CDMO landscape, and we believe it's the most important part of the market. So it's great to hear that it's really interesting for you.
Yeah. And I have to say, if you allow me, that during last year, during 2024, I have been talking with so many CMOs, and but it is not the same, having a call or something like this, that being face-to-face.
Yeah.
And talking and meeting each other, and it creates some kind of human link,
of course.
Which is something that it's necessary nowadays.
It is.
There are other events, but are not so focused on this area. So you can meet people from your business, but the business is so high, the pharma industry is so high that and so big, that it's difficult to get people that talk the same language as you, same needs, understand perfectly what you are going to say, and you understand what they are saying to you. So for us,
it's great to hear. And as I say, for us, from your side of the table, from the CDMO side, it's just these are critical conversations to have, but they're not always easy to have. So hopefully that's going to be a great platform for you this year and going forward. Let me ask you a couple of questions, if I may, just on the industry and your perspective from Capital Farma on things. So supply chain uncertainty at the moment is obviously a concern. It's an issue. What strategies, what plans are you using to try and navigate that? Not easy, I know, but what does that look like?
Not easy, but it is the starting point of Capital Pharma itself. What we want is try to relocate projects in Europe and manufacture some APIs that have a useful life, but maybe not. We are focused on generic.
Yeah.
But of course, everything, every single company wants an innovator, and want to innovate. But we can never forget that there are a lot of people that need to access to medicines in a safe and in economical way, let's say. No? So innovation, of course, has to be the arrow of the industry, but we care about generic also because Europe needs to have a strategically and well-positioned industry about generic to have medicines when we need. Because it's about people. This business is about people in the end, no? And healthcare is about people. So the starting point of Capital Pharma is relocating and giving back APIs that we could have some problems in the future here in Europe and that are not manufactured here in Europe, or at least maybe one or two manufacturers that this and risk in the end the supply chain. No? So in this river we are trying to swim.
I'm sure.
And the strategy is going not so bad, and the thing is that it is not easy to find the way. No. They find the way and find the products.
Yeah, 100%. I completely agree, and I can understand your perspective on that. I've literally just come out of another session where we've had a series of round tables, and one of the themes within the round tables was on the importance between partnership, which obviously in this part of the industry is so important because that's what it's about, right? It's about partnering. So strong partnerships between a sponsor and a CDMO is always a critical theme. From your perspective as a business, with everything that's happened over the last 3 years, what tips can you share on how to make that partnership work effectively from your side?
Yes. Our side is we hire the contract manufacturing, so we are the let's say the customers of the CMOs. From our side, well, we will need this open communication. It is something that it is very important, and strong commitment and communication, because in every single project in this industry or research development, there will be problems for sure. It is impossible to have a clean and lean project. Impossible, no. But problems needs to be solved, and the thing is not the problem itself, but how you react to the problem and how to manage. So for me, the key is communication, open communication. We need and all the structure need to let the people work. You know, this is a very technical industry, and I know that I cannot have all the knowledge, but I trust in the people. I cannot trust in the people if the communication is not clear. No? So for me, that's the key, and
so that's the key ingredient in that partnership.
Me, yes.
And what about the biggest mistake that people make in outsourcing? Now, it may be a slightly unfair question, but the biggest mistake, and also what would you try to change about the industry in terms of how they approach it around that mistake?
Yeah, for me the mistake is it's a well question. It's a very good question. For me the mistake is to how to say, I have the word in Spanish, but undervalue. Undervalue the effort you need to do
I see. So you think it will be easier than it actually is, perhaps?
Yes, in terms of timelines, for example, so it is something that it's very difficult, but the mistake is okay, make an estimation, in 6 months we can do that, and 2 months we can do that, and it can compromise the whole project itself. So for me it's better to give a breath and understand that things are going good for sure, but maybe some... This tightness in the planification for me is the worst mistake.
Okay.
It implies a lot of.
I could fully understand that. Now, what about AI, digitalization in manufacturing? I mean, there is so much happening in this area. I mean, on a global general level, the pace of change is incredible. What does that look like in your world? What's your approach as a business at Capital Pharma?
Yeah, we are. I'm not afraid of IA, but I think it's very young right now. It's like trusting in a kid. Okay, maybe you have you're feeling your thoughts, but we need to be careful with that. No? So we use IE in terms of research, market research, but we always compare with our own estimation, no? But
Yeah.
we are trying to include it because it saves time. Time is money, and it's a kind of.
So you have a place. You're trying to make sure that there's certain stages where you can really use it in the research, etc. But equally you have some balances and measures around
yes,
it,
yes.
etc.
Maybe in the future when we know that the information we get is,
Understood.
No.
Yeah.
And the other thing is trying to in every single project we manage, we try to improve all the cost in every single stage.
Yeah.
So, but it is difficult. But no, there are some tools and other kind of not classic chemical, but flow chemistry and so on. That I think it will change.
What about
the industry in a few years?
Yeah, no, I mean, it's moving so quickly.
Yeah.
It will happen, but for sure. But the pace and the stages that companies approach it at, I think, will obviously always be different. What about sustainability, net zero, etc.? These are key objectives across the biopharma industry. They can also be quite difficult to focus on with every other challenge that's happening. What are you doing to drive the agenda in this space? How do you feel about that as a business?
Yeah, for us it's crucial, it's critical, it's highly important. But the thing is that I feel that it need to be well sustained by authorities, for example. So it has a sense for us to make a perfectly lean process, but we need to be competitive, no? And I read a few days ago some guidelines from the European Commission that were concerning about this balance or imbalance between one countries and other in terms of environmental measures, and they were concerned, and I think it should be push also for the authorities, because we need to gain competitivity. No, it is not easy, but maybe impossible if we don't have this support behind. So we care about it, but it's an issue. It's an issue right now.
Yeah, I would understand. Couple of quick last questions. You've been kind enough to summarise your thoughts on CDMO Live as a whole, etc. What's one single or the single most valuable insight that you'll take away in terms of something you've learned, something you've come across, a conversation, a piece of insight that you would say is really key for you so far on day one?
Yeah. For me, I will take the feeling that there is capability. There is capability, and there is a space for new projects. There is a space for new manufacturing, for new products, for taking those products that are under rational risk and bring it back to Europe to try to establish a well-support chain. How to say? World support. I would say chain value, but not chain value.
Value chain. Yeah, absolutely. Of course.
Sorry.
No, not at all. Of course.
So the feeling is that there is capacity and there is.
Okay.
Real possibility. So.
Final question, Carlos.
Question.
A difficult one, but if you had to give one prediction for the future of pharmaceutical manufacturing, something that maybe isn't happening now, something that you think will be a big focus in the future, any one prediction that you'd highlight?
For me, I think future will be the ADC and payloads and all this technology.
Yeah.
But I think we will have a very good support of previous technology, affordable, cheap, and for me, for example, the trends will be nervous system and oncology.
Yeah.
I think that we will have a very good support on generic products for these kind of diseases or these pathologies, and the future is focus therapies, and I think that it will be the trend will be like that. The industry will move like that, but with the hope that we will have a very good support on all technologies. Let's say, no, all in pharma industry, all these 5 years is something like this, no. But there is for me, it's a clear horizon.
Yeah.
So
okay.
That's my feeling.
Thank you, Carlos, it's been great fun talking to you. I've really enjoyed the conversation. Great to get your perspective at the stage that Capital Farma is at. Thanks ever so much.
Thank you very much. Thank you so much.